Welcome to Chapter 33 of the Mahon textbook. We are going to be talking about skin and soft tissue infections. Usual skin flora consists of both permanent and transient organisms, and these offer protection from both pathogens and ultraviolet rays. And these are flora that have adapted to a higher salt content found on the skin. The usual types of skin flora, there is the permanent resident, which is coagulase negative staph. That's the permanent resident, while Staph aureus can be a transient colonizer. We have diphtheroids, and remember we learned that diphtheroids are just a contaminant. You might as well just say there's dirt on it. But those include things like Propionibacterium that cause acne, and Corynebacterium, also Candida, which is a yeast, and few gram-negative rods are also can be normal flora. Pyoderma are skin infections characterized by inflammation and pus. And go ahead now and know that most of this chapter, the only thing new will be maybe some terms, but definitely you need to know these terms. So know the definition of pyoderma, and we're going to talk about these common forms. Impetigo is the most often caused, well, it's not most often caused, but it is a skin infection caused most often by strep pyogenes or group A strep. It can be caused by Staph aureus because it produces that exfoliative toxin, but most of the time it's going to be caused by group A strep, and it is extremely, extremely contagious. What is erysipelas? Erysipelas is a deeper form of cellulitis that infects underlying dermis and even lymphatic channels. It usually affects the face and lower extremities, and it's just a painful raised, it has a sharp demarcated border, and that's going to be important because we are going to talk next about cellulitis. And whereas erysipelas has a very sharp demarcated border, cellulitis has a poorly demarcated border. It's still localized, you have swelling, it's mildly painful, there's going to be diffuse inflammation. And again, the same culprits are involved in a lot of these skin infections, group A strep and Staph aureus, but cellulitis, know that definition. Folliculitis is inflammation and infection of the hair follicles, usually found in areas or points of friction. Staph aureus is the most common agent, but Pseudomonas aeruginosa has been implicated in swimming pools and whirlpools. Don't you just want to go for a swim now after learning about pathogenic microbiology? So what is a form of folliculitis in bearded men? And that is Ciscosis barbae, or barber's itch. It can affect the upper lip, the chin, and around the jaw. So you need to know that folliculitis of the beard is called Ciscosis barbae. You need to know the definition and differences between a furuncle and a carbuncle. So what is a furuncle? It's a deep inflammatory nodule. And what is a carbuncle? It is a deeper abscess that extends into the subcutaneous fat, and it may have multiple draining sites. And there's a lovely picture that's coming up next. Carbuncles are also known as boils, most commonly caused by Staph aureus. And in addition to antibiotics, these carbuncles may require surgical drainage. So not just regular oral antibiotics either, maybe even IV antibiotics. So this is what a furuncle looks like. This just kind of more on the surface of the skin, and then this carbuncle with multiple draining sites. Lovely. What is parenchyma? Parenchyma is the infection of the cuticle surrounding the nail bed. Staph aureus and Candida are the usual pathogens, and we remember that Candida is a yeast, so it's in the fungal class of organisms. Okay, so more infections. Myonecrosis is an infection of the muscle. It's a deep tissue death occurring from a drop in pH due to a reduction. Well, we don't really need to know about that, but it's very painful. There will be swelling, cellulitis, production of gas. Remember, if you, this is where if the physician touches the wound, it could crinkle like a crunchy because there's gas in there. There will be a foul smelling discharge. And this is also, if it's from a Clostridium infection, it's called gas gangrene. The most infamous type of myonecrosis is gas gangrene, which is caused by Clostridium perfringens. And most of these infections are also polymicrobial, which means that there's more than one bacteria that's causing the infection, and it's usually a mixture of aerobic and anaerobic. Also, we've heard a lot in the past about the flesh-eating bacteria. Well, there's more than one, but usually when you hear flesh-eating bacteria in the newspaper or on the news, it's a group A strep, unless we're on the coast. Then, from time to time, one of our coastal um, neighbors gets hurt or gets a scratch and gets infected in our brackish water or in the Gulf and gets infected with a Vibrio. And so Vibrio can also turn into a flesh-eating bacteria. Um, so just keep that in mind. But usually, like Jim Henson, who is from Mississippi, and he made the Muppets, if you guys remember what that is, he died from a group A strep infection with the flesh-eating bacteria. Particular areas of problems for skin infections are burns and bites. And I know you know what I'm talking about. You've seen kids down here in the South. Mosquitoes are crazy in the summer. So people get bitten with mosquitoes and they scratch, and then they end up getting their skin or their bites infected with their normal skin flora. Secondary bacterial skin infections can be caused from toxin productions, such as the staphylococcal scalded skin syndrome toxin, the toxic shock syndrome. Strep can produce a toxin, and scarlet fever causes the rash from a strep toxin. Other organisms that may cause problems with the skin, mycobacteria. We talked about that in Micro 1. Spirochetes, treponemes. We can have viral skin infections, and those manifest usually in warts, but also the rubeola, measles rash. We can have fungal skin infections. We learned all about that in microbiology 1. And also, you talked extensively about parasites and also in that class. So one of the standouts, you need to know, what is herpetic whitlow. Herpetic whitlow is herpes simplex virus 1 or 2 infection in a finger. All right, ringworm. What is a ringworm? It is the fungal infection of the skin. And what is thrush? Thrush is oral candidiasis. So it's an oral infection with Candida albicans, or another species of Candida, but a yeast infection. Cultures need to be taken from as deep in the wound as possible to avoid contamination with skin flora. Aspirates or tissues is the specimen of choice. We do perform gram stains on these skin cultures. We want to inoculate. Which plates do we want to use? We want to use the blood agar plate. We want to use the chocolate plate. We want to use a Columbia CNA agar that is going to be selective for gram-positive organisms. We're going to use a McConkey agar that is going to be selective for gram-negative. We're going to use a thio broth that will catch everything and some anaerobes. And then possibly we might want to add some anaerobic agar depending on where the wound or the skin infection is. So what do? We are going to incubate this overnight, and then the next morning we're going to read it 24 hours. And if there's no growth after 24 hours, we're going to re-incubate for an additional 24 hours. And when we are looking at growth on a plate, we need to consider the gram stain report, the ratio of normal flora to the potential pathogens, and then work up only the pathogens to provide identification and sensitivities, because we don't want to waste time or money. All right, so we're going to stop here with chapter 33, and we're going to come right back and do a practice.